Relaxation therapy, reducing the anxiety response associated with breathlessness. Active relaxation is different than recreational time. Relaxation therapy decreases the effects of stress on your body and mind and can help you to cope with everyday stress and with stress related to various health problems such as heart disease, pain, and breathlessness. Tension in the muscles is associated with tension in the mind. If tension is eliminated from the muscles, the feeling of stress is reduced. There are many different methods of relaxation therapy, and finding one which suits you is important. For some, this may be as simple as listening to the right music or carrying out a body scan, relaxing all of the muscles within the body in turn. Some of the known physiological benefits of relaxation therapy: reduces heart rate and normalizes blood pressure, reduces the breathing rate and improves digestion, reduces the impact of stress hormones on the body and tension within the muscles. There are some resources at the end of this session which will enable you to access online relaxation sessions. Mindfulness. This may sound difficult, but it isn't hard. We just need to remember to do it. And remember, almost everything will work again if you unplug it for a few minutes, including yourself. The principle of mindfulness is to learn to be in the present and enjoy the moment, and to move away from having a very full, stressed mind. Be aware of what is happening right now without responding to it or wishing that it were different. Enjoy the pleasant without holding on to it when it changes, because it will, and being with the unpleasant without fearing it will always be this way, because it won't. A simple technique for practicing mindfulness is to focus on the five senses. Think of five things that you can see: the sun in the sky, a picture on the wall. Four things that you can feel: the wind on your face, your feet on the floor. Three things that you can hear: passing traffic or the birds singing. Two things that you can smell: it may be food cooking or the smell of freshly cut grass. And one thing that you can taste: it may be the mint of your toothpaste from earlier in the day. If you are struggling to imagine these things, think of your favourite taste or smell and think of that instead. Fatigue is a common complaint reported by patients with a long-term condition, and managing energy levels is an important way of dealing with this. Exercise helps to make the body to be as fit as it can be, ensuring it is working in an efficient way, and it is essential to counteract the effects of deconditioning. However, managing energy levels helps to make the best use of energy, ensuring that the body is working in the most efficient way. Imagine that your energy levels are this jug. Some activities will top the jug up, while some will empty it. And it's important to think about what you're going to use your energy on. And make sure that you always keep some in reserve for the next day, as depletion of energy levels will result in extensive recovery periods and inactivity. Boom or bust. Try to avoid all or nothing or boom and bust patterns of activity. Doing too much leads the body to require extra recovery time. Try to hold back a little on a good day to enable you to do more on a not so good day. The basic rules of energy conservation. Think about: is this task necessary or urgent? Can someone else do the task? How do I want to do it? How could I make it easier? What would be a better way of doing it? And think about your posture, positioning to aid breathlessness. There's a link at the end of the presentation to the College of Occupational Therapy that has some extra resources on energy conservation strategies. Useful tips for conserving energy. You will achieve more in sitting than you will in standing. Break tasks down into small, bite-sized chunks and focus on endurance, not speed. Maybe use a toweling dressing gown after bathing, or a hairdryer can be used to dry your feet if bending is problematic. Think about occupational balance, saving some energy for recreational and leisure activities. Maybe keep a diary, plan out your activities and chores, and make note of your best time of day. Consider the strategies that can be used in the 3 circles of breathlessness. Breathing circle, using your fan, breathing techniques, and think of positioning and posture. Thinking and anxiety, consider mindfulness, relaxation therapy, or addressing your concerns and misconceptions with others. Functioning circles, activity pacing, encouraging exercise and strengthening activities, maybe the use of walking aids. Considering all the strategies that have been discussed will help you to work out an action plan and to take control of your breathlessness. Think about knowing that you have had this feeling before and that it does go away. Plan that you are going to lean forward, you're going to use your fan, breathing control, or focus on being mindful and concentrate on gently breathing out. Remind yourself that you can do this and that you are doing it right now. There is no need to be frightened. You will be okay. If you are able to consider all the aspects of breathlessness, you may well be able to reverse the cycle of deconditioning. And instead of not feeling like doing something because activity makes you feel much worse and anxious and fearful, you're able to be positive and set achievable goals, returning to more normal activity levels, which will in turn increase your strength and stamina and increase your capacity for activity and reduce the impact of breathlessness. You may find the following resources useful in seeking out additional information around breathlessness, anxiety, and managing the fatigue and the impact of breathlessness. Or you may speak to any members of the team for further help and support. Thank you for listening.